Left ventricular hypertrophy due to hypertension. Pathology overview. Left ventricular hypertrophy happens when the walls of the heart's left ventricle thicken due to the heart working harder to pump blood because of high blood pressure. This thickening can make it harder for the heart to work well and lead to complications like heart failure or stroke if untreated. Treating high blood pressure can help reduce left ventricular hypertrophy or stop it from getting worse. Diagnosis. Doctors use several tools to diagnose. Physical exam. Doctors check blood pressure and listen to the heart for abnormal sounds. Electrocardiogram, echocardiogram, heart MRI, and lab tests. Treatment. Doctors prescribe medicines to lower blood pressure and help the heart work better. These include ACE inhibitors, calcium channel blockers, diuretics. Lifestyle changes such as eating less salt and following a heart-healthy diet, exercise regularly, lose weight if needed, and avoid smoking and limit alcohol. It's also recommended to have regular checkups to check your blood pressure and heart function. SOAP method. Subjective. The patient may not notice symptoms at first but could experience shortness of breath during activity, feeling tired or weak, chest pain when active, irregular or fast heartbeats, dizziness or fainting in some cases. Objective. Physical exam may reveal abnormal heart sounds or swelling in legs. Electrocardiogram may show signs of thickened heart muscle. An echocardiogram confirms thickening of the left ventricle walls. Assessment. Left ventricular hypertrophy is diagnosed when the heart's left ventricle muscle is thickened due to long-term high blood pressure stressing the heart. Plan. Start or adjust blood pressure medications, encourage lifestyle changes, regular follow-ups, treat any other related problems such as valve disease if present. The AI component that I chose was open evidence. Pathology overview. Left ventricular hypertrophy secondary to hypertension is a maladaptive increase in left ventricular mass due to chronic pressure overload. Diagnosis. Echocardiography is the first-line modality. Treatment. Most experts recommend aggressive blood pressure control, first-line antihypertensive agents, combination therapy, lifestyle modifications, and serial echocardiography. SOAP method. Subjective. Patients with left ventricular hypertrophy secondary to hypertension often report few or no symptoms. When present, symptoms may include exertional dyspnea, fatigue, palpitations, or chest discomfort. Objective. Physical examination may reveal a sustained apical impulse or S4 heart sound. Blood pressure is typically elevated. Assessment. Hypertensive left ventricular hypertrophy is diagnosed by imaging evidence of increased left ventricular mass in the context of chronic hypertension, after excluding other causes such as aortic stenosis or infiltrative cardiomyopathies. Plan. Aggressive blood pressure control, first-line antihypertensive agents, lifestyle modifications, and serial echocardiography. This is my table that shows the 5 sources that I used with the AI component. Scientific method. Observation. Left ventricular hypertrophy associated with hypertension. Hypothesis to detect the frequency of left ventricular hypertrophy in patients with newly diagnosed hypertension. The article that I chose to do my research on was a cross-sectional study. The sample was conducted in September of 2018 to September of 2019 amongst 120 patients. 71 were males and 49 were females with the mean age of about 47. Results and conclusion. In this study, 41 patients had stage 1 hypertension, whereas 79 had stage 2 hypertension at time of diagnosis. Sokolow-Lyon criteria showed 21 patients had left ventricular hypertrophy, 17 patients had left ventricular hypertrophy as per Cornell voltage criteria with an overlap of 9. Echocardiography revealed left ventricular hypertrophy in 28 patients, amongst which 24 had stage 2 hypertension and 4 had stage 1 hypertension. In conclusion, a significant number of patients with newly diagnosed hypertension already had left ventricular hypertrophy due to lack of screening and education. This knowledge signals that the heart has already undergone structural damage from the high blood pressure, moving the patient into a much higher risk category for serious cardiovascular events. My reflection. I enjoyed using AI throughout this assignment. I used 2 different AI generators, Open Evidence and ChatGPT. I felt both AI generators were accurate with their information as well as credible. In comparing my own research to AI, it was similar. However, AI provided information I thought was useful that I did not find myself. ChatGPT also gave me great ideas for my PowerPoint slides, such as adding images and how to organize the information to each slide. All in all, I felt using AI was useful in my research. Thank you.